Welcome to the Practical Caregiver. My name is Peggy Kelso. I am the founder and president of the Council for Health, Education, and Development, CFED for short. It's the purpose of CFED to provide quality caregiver training to the general public for the continued health of the family unit. As a certified speech-language pathologist, I have served as the director of rehab in the acute care hospital setting, as well as in long-term care facilities. Having worked as a therapist with the elderly for over 20 years, I have come to the realization that there are many resources offering information about care, but it is difficult to find hands-on education that families need in order to properly and safely care for their loved one, or, for that matter, to judge the quality of care their loved one is receiving in other settings. By viewing this presentation, I know you have concerns about taking care of a loved one. I hope you will find the answers to your questions. The skills you will need in order to take care of your loved one are presented in 7 sections. Basic body mechanics, positioning, transfers, ambulation, self-help, feeding, and communication. Remember, these are basic, general, non-prescriptive techniques that therapists use in the healthcare field on a daily basis. Not all of these techniques may be specific to your loved one. If you have special concerns, specific precautions, or are currently in a rehabilitation program, your healthcare professional will provide techniques and possibly assistive devices that are specific to your needs. Now, if you're ready, let's get started with the Practical Caregiver. We will begin with the principles of basic body mechanics, the foundation of safety for both you and your family member. Poor body mechanics is a major cause of back injuries. Using good body mechanics when acting as a caregiver will not only save your back, but it will make you more aware of situations where both you and your loved one could sustain an injury. Before lifting or moving an object, test the weight of the load to make sure you can move it safely. Use an assistive device if necessary. Make sure the path is clear before moving the load. Do not lift if you can push or pull. To pick up a load, use a wide, balanced stance with one foot ahead of the other. Keep the lower back in its normal, arched position. Bend at the knees and hips, bringing the load close to the body as you tighten the stomach muscles. Lift with your legs. To turn, pivot the feet. Do not twist. If 2 or more individuals are involved in the lift, communicate with each other. When both of you are in the correct position, count 1, 2, 3, and then lift together, avoiding any sudden or jerking movements. It may help you to remember the word spine when trying to recall the basics of body mechanics. After all, that is the area we are trying to protect. S is for stand. Your feet should be approximately shoulder width apart, with one foot ahead of the other, to provide better balance and a good base of support. Bend with your hips and knees. Keep your back straight. Lift with your legs. P stands for pivot, push, and pull. To change position, move your feet. Never twist. Do not lift if you can push or pull. I is for incorporate. Incorporate smooth, even movements into the lift. Count 1, 2, 3, lift when lifting with others. N is for never. Never use your back to lift. Lift with your legs. E stands for evaluate. Evaluate the load. If you can lift it by yourself, hold it close to your body. If you cannot lift it by yourself, ask for help. Let's begin to put your new skills into practice as we address positioning. Positioning is important because it can help prevent bed sores, contractures, and pneumonia. 2 important rules to remember when acting as a caregiver are: 1. Always inform your loved one about what you are going to do. 2. Instruct him or her in how to assist you as much as possible. For general use at home, we will use pillows, cushions, towels, and washcloths for correct positioning. Sitting in a chair or sofa is of the utmost importance, since that is the position we assume the majority of the day. These techniques can also be used when the person is seated in a wheelchair. Distribute your weight equally, with the spine and legs aligned. Small pillows or a rolled towel may be used between the chair and the small of the back to prevent slumping and to increase comfort. The buttock should be against the back of the chair, and the knees should be extended slightly beyond the end of the chair. If the person is short, pillows or cushions may be placed behind the person to push him or her forward, so that the knees are extended slightly beyond the edge of the chair. Both feet should be flat on the floor for support and to prevent foot drop. If the feet do not reach the floor, place a small pillow, a stool, or a stack of books under them to use as a footrest. If a person needs to be repositioned in a chair and is unable to assist, you may assist by standing behind him. Explain what you will be doing. Then have him lean forward. Place your arms in a hugging position as close as possible to his waist. On the count of 1, 2, 3, lift the person into position. If a 2-person lift is required, 1 person stands behind the person seated, placing his arms around him in a hugging position as close as possible to the person's waist. Remember, tell your loved one what you will be doing. The 2nd person grasps the legs of the person seated, being careful not to lift at a joint or any tender area. On the count of 1, 2, 3, lift together and place the person in the correct position. If it is impossible for either person to get into position behind or in front of the person seated, one of you should stand on one side of him and one on the other. After telling your loved one what you will be doing, place one hand behind his shoulders and one hand under his leg. On the count of 1, 2, 3, bring the person up to a sitting position. Sometimes the person may need to have their feet elevated. In this case, place pillows under the knees for added comfort and to flex joints. It is important to reposition or shift your weight every 2 hours. In addition, extend your joints by flexing your arms, legs, and ankles occasionally. Joints should be flexed slightly while at rest. Arms may rest on an armrest. If there is no armrest, create one by placing a pillow or pillows to the side of the person and resting the arm on top of the pillow. If your loved one must be in bed, make sure the mattress is firm. If he is lying on his back, be sure his body is in a straight line from his chin to stomach to lower body. Place a pillow under the head and upper shoulders to prevent contracture of the neck. You may roll a small towel to support the lumbar curvature of the small of the back. If the hips have a tendency to rotate to the outside, you can roll towels and place them on either side of the hips. Small pillows or towels may be placed under the knees. Pillows or rolled towels placed under the ankles help prevent pressure on the heels. To support the feet and to prevent foot drop, place a rolled towel, cushion, or pillow at the end of the bed. If there is no footboard on the bed against which to position the towel, cushion, or pillow, secure it by tucking the sheet tightly under the mattress. The feet should rest lightly against the towel, cushion, or pillow. The sheet should not bind the feet. If one arm is non-functional, it is important to always support the affected side. Place one or more pillows to support the weak arm and hand, with the forearm slightly bent to prevent contractures and swelling. A rolled washcloth may be placed in the weak hand to prevent further contractures. To position a person on their side, it is preferable to have them lie on their strong side. To aid in turning, place one hand on the person's far shoulder and one on the far thigh area. Bend the weak leg and carefully roll your loved one onto their side. Place a rolled pillow behind him for support. Bring the bottom shoulder slightly forward. Flex the bottom arm up and support it for comfort. Use a pillow to support the top or weak arm. The top leg is flexed in front of the bottom leg. Use a pillow to support the top or weak leg. Support the bottom foot to prevent foot drop. Tuck the sheet in and pull it lightly over the pillow to maintain positioning. To roll to the strong side unassisted, clasp the weak arm with a strong hand and reach toward the ceiling. Bend the knee of the strong leg and place the foot under the ankle of the weak leg. Rock toward the strong side, swinging the arms over and bringing the weak leg over, using the strong leg. To aid the person in sitting, bring his legs off the bed as you have him push up from the bed with his strong arm. You may assist by placing an arm around his shoulder, bracing the neck. Keep pushing until the person is sitting upright. If one leg cannot bend, bend the good knee. Grasp the knee and begin to pull to a sitting position. Use the edge of the bed to pull up and push with the other hand. Move the good leg to the floor, then move the weak leg to the floor. If your loved one wants to sit up and you cannot raise the head of the bed, use pillows to achieve an incline of 30 to 45 degrees. Align the head, trunk, and legs. Support the shoulders with pillows. Support arms and hands with pillows. You may place a pillow under the thighs to prevent slipping, and you may brace the feet to prevent foot drop. After your loved one is positioned, and before you leave the room, make sure all needs are met: water, tissues, remote for TV, phone, etc. If your loved one cannot assist in positioning and requires extra help, you may use a draw sheet. Place a partially rolled sheet next to his side, tucking it under the area of the rib cage and hips. Go to the other side. Bend the far leg up. Grasp the thigh area and shoulder. Roll the person toward you. When he is balanced, begin to unroll the sheet and tuck the remaining part under him. Now carefully roll him onto his back. Go to the other side. Again, roll the person on his side. Reach over and straighten out the draw sheet. Grasp the draw sheet at the top and bottom on one side. On the count of 3, pull up on the draw sheet. Move around to the other side of the bed. Repeat, moving from side to side until the person is correctly positioned. A 2-person lift is easier and safer. One person stands on one side of the bed and one on the other. Grab the sheet at the top and bottom. On the count of 1, 2, 3, move the person up in bed or down in bed. We will now demonstrate basic techniques involved in safely helping someone move from one position to another, assuming he can help in the transfer. It will be important for you to remember to use good body mechanics in order to prevent injury to yourself or to your loved one. Do not attempt transfers if the person is too heavy. Ask for help. The safest way to assist a person in a transfer is to use a gait belt. It has a hinge on one side and the other side is fixed. Place the belt around your loved one. Pull the end of the belt through the hinged side, over the top, and through the slot on the fixed side. To tighten the belt, grab the center part of the belt and pull it to the side. Then pull the end of the belt to get rid of the slack. You can then loop the excess part of the belt in front or tuck it in the side of the belt. The belt should be loose enough so that your hand can slip under it easily. Place your hand under the belt with your fingers up so that you can easily grip the belt. We will begin with using the gait belt to aid a person in standing. Tell the person what you will be doing. Have him lean forward as you place the gait belt around him, and scoot forward in the chair so that both feet are flat on the floor, about shoulder width apart. It is best if he or she is wearing non-slip shoes. Stand in front of him, with one foot slightly in front of the other, blocking his feet and knees. Have him push up from the chair as you grab the gait belt, bending at the knees and hips. Come to standing. In order to transfer from the bed to a chair, again tell the person what is happening. Place the gait belt around him. Place the chair at an angle and as close as possible to the bed. Be sure both feet are flat on the floor. If one arm is weak, cross it in front. On the count of 3, he pushes up with his strong arm as you grab the gait belt, blocking his feet and knees. As you help him stand, his strong arm is moved to your shoulder area. Pivot toward the chair. He reaches back for the armrest with his strong hand as his legs touch the chair. Gently lower him to sitting. To go from the chair to the bed, stand in front of the person with one foot slightly forward. Be sure both of his feet are flat on the floor. If one arm is weak, fold it across. As you bend and grab the gait belt, have the person push up from the chair with his strong arm. Then have him place his strong arm around your shoulder, not your neck. Place your feet and knees so his feet do not slip and his knees do not buckle as you pivot. Have him reach for the bed as his legs touch the bed. Gently lower him to sitting. Toilet transfers can be difficult. Check with your healthcare professional for techniques appropriate for your loved one and to determine if an elevated toilet seat is needed. For a basic transfer, bring the wheelchair in as far as you can. Lock the brakes. Remove the footrests if possible and reposition the chair closer to the toilet. Lift the weak leg as you reposition the chair. Lock the brakes. It is preferable to transfer a person to his strong side. However, this is not always possible. Transfers to both the strong and weak sides will be demonstrated. Place the gait belt around the person's waist and tighten it. Stand with one foot slightly in front of the other, blocking his knees and feet. Fold the weak arm toward his chest. Grab the gait belt and help to scoot him forward so that both feet are flat on the floor. On the count of 3, begin to lift as the person pushes up on the armrest with his strong arm. As you pivot, he can reach for the grab bar. When standing and balanced, you may help him lower his clothing. Lower him to the toilet as he continues to hold the grab bar. To return to the wheelchair, be sure the person has both feet flat on the floor. He can pull up using the grab bar as you bend, grasping the gait belt and blocking his feet and knees. On the count of 3, come to standing. At this point, you would help to lift clothing. When clothing is in place, fold the weak arm over. Have him release the grab bar and reach for your shoulder as you pivot together to the chair. He then reaches for the armrest as his legs touch the chair. Gently lower him to sitting. Now we will transfer to the weak side. Bring the wheelchair up to the toilet. Lock the brakes and remove the footrests. Unlock the brakes, lift the weak leg, and move the chair closer to the toilet. Lock the brakes. Put the gait belt on. Fold the weak arm across his midsection. Be sure both feet are flat on the floor. Grasp the gait belt. Bend and block his knees and feet. On the count of 3, lift as the person pushes up. He reaches for your shoulder area with his strong arm as you pivot together to the toilet. Have him reach down toward the arm of the wheelchair for support. Lower clothing when standing and balanced. Then lower him to sitting. To go back to the wheelchair, be sure the person's feet are flat on the floor. Have him push up on the armrest on the count of 3 as you grab the gait belt, bending and blocking his knees and feet. Help him to stand. You can help lift clothing at this point. Then fold the weak arm across and pivot as he puts his strong arm around you at shoulder level.